This is the question I'd like to address. It's a really highly relevant question that I often get. And the question is what is the fastest and quickest way to get business or new patients? And, when people call and they're calling about whether it's marketing or advertising or whatever, sometimes people are in a more stressful predicament than others. And so a common question that I get is, what can I do the fastest to increase my business? Now, when it comes to getting new business, remember, there is an order to get new business. It's not some mystical formula. There is an order. And remember, there's five areas when people have a perceived need. So all we're going to do is look at the S-curve, and then we're going to look at the 5 areas of where they buy. Well, when we buy, so let's give an example. If we look at the S-curve, we know that 8% of the people are looking for chiropractors. So we also know that advertising gets those people. Okay? So we know the right side, the 92%, are not looking for chiropractors, and you have to use educational sales to get those people. So it depends on what side of the curve, whether I'm going to use promotions for the left side of the curve, or advertising, or educational sales for the right side. That's very important. Then I have to look at, well, what are the 5 categories that people will buy from? Remember, there's 5 categories that when people are looking for a product or service that they'll buy. Number 1 is always the introduction. That's always the referral. Always. In every industry, no matter what the industry, trust is always number 1. After the introduction trust category, then it depends on your industry. In chiropractic, 75%. And it's, by the way, this is not just a chiropractic statistic. This is a professional statistic. Dentists, in other words, brick and mortar facilities where you actually have to drive to a facility. But it's especially important with chiropractic, even more so than dentists and attorneys, because the frequency at which you have to go to the facility. In a chiropractor's office, you may have to go daily or 3 times a week or twice a week in the first week, 2-3 weeks. So proximity is even greater of importance than, say, an attorney who maybe you only have to see once. You'll drive much further one time than 3 times a week driving far. So it will vary per industry depending on the frequency and the time spent at that facility. The higher the frequency and the more time spent, the less your radius of draw. So having said that, the introduction systems are always number 1 because it's trust. And then after the introduction systems is the active referral systems. In other words, you actually communicating patients and getting them to bring somebody in as opposed to waiting. And then there's what's called the passive referrals. And then there's the leads, up to 15%, and the cold calls. So the worst business is the cold calls. You don't know them and they don't know you. There's no trust. The second worst is the leads. The active referrals. So the best potential business, if we looked at those 5 categories, are the introductions. So having said that, we know the 5 reasons of where they'll go. Now we have to look at whether it's advertising or educational sales, dependent on the S-curve. So if you're going to look at and then one last category to consider is the 80-20 to Pareto's principle. That's the last category to consider. In that 80% of your 20% of your business essentially will create 80% of the revenue. It's basically a ratio that says the minority creates the majority, and it plays out in every industry. It's an economic principle that was developed by an Italian economist, Prato, in the 20s, and he statistically showed this. And when you look at your practice or any business, you'll see this. And the example is, and it's really divided into 3. So it's not exactly 80, it's not exactly 20. It's essentially, I call it the 18-17-17-3 principle. So 80% of your people will come and go and not refer, or very sporadically. 17% of your people will refer. And then 3% will not just refer one, they'll refer multiple people. So those are the 3 factors that we're going to consider when you go, okay, what is the fastest business to get the quickest? Well, here's what it is. If you're going to go to the advertising side, we want to go into introductions, if we're going to use advertising, introductions, So what are introductions? There's 5 types of introductions. There's the spouse, the child, the circle of influence, the 20 percenters, and the 3 percenters. Those are the 5 subcategories of introductions. So if you want business the quickest, the fastest, that's where there's the highest trust category, and there's the highest probability of actually having a need for your product or service. So now you have to decide, are you going to do advertising, or are you going to do educational sales, or a combination of both to do that? Now, that's the advertising side. Now, the educational sales side is the same thing. Now you have to use educational sales, but I'm still going to go to introductions and active referrals. You see, if you knew the components of referrals, if you knew why people did not refer, if you knew how to trigger the 7 core components of a referral, then every day you can get a new patient in your office if you knew what to say. If you knew those 7 things to say, every day in your office you could get a new patient instead of waiting for somebody to send somebody in. So that's called educational sales. That takes knowledge and skill. You have to know something about that. So there's a huge dichotomy in whether it's the left side, the 8%, whether it's the right side, the educational sales, and then the doctor's knowledge and skill level. If he doesn't know educational sales, there goes the 92%. They're off the mat. They're not even accessible. Now you're down to the 8%. So the best form of marketing, the quickest, fastest, after isolating retention and plugging your hole in retention, and if you're just now looking for new bodies, but remember, you never want to look for new patients unless those holes have been analyzed and plugged, because wherever those holes are, you'll drop everybody through those exact holes, and you'll waste a lot of time and money. So the next category, when you're looking at new business, is not just are they looking, not just your skill level, but also is there a need, is there trust, and then leverage of time. That's the last factor, leverage time. So the considerations are the S-curve, Pareto's law, the 80-20 principle, education, promotions, advertising, educational sales. And so which one would have the greatest impact? And then leverage of time. In other words, it's not one-to-one. And now it's you to a group or somebody to a group. Okay? So having said that, what's the absolute #1 marketing system to get new business? The absolute #1 system is to go to your introduction patients, In other words, those are your existing and past patients that already know, trust, and like you. And their family members, their circle of influence, high trust category. Now, I am not talking about people outside their circle of influence. It's people in their high inner circle of influence and your 3 percenters. So you take your patient base, find your 3 percenters. Who are the people who are referring 2 or more people? That's your 3 percenters. They've already shown a willingness and desire to go out of their way for you. That's your highest introduction, highest proactive category. Now I'm going to take that group and I'm going to do educational sales to that group, not just advertising. Now, if I don't know educational sales, the only thing I can do is advertising. But let's face it, there's not as much business when you go after 8% that are looking versus 92%. And because remember, 75% of those people have back or neck pain to some degree. So the difference is 69% of people who have what's called a gateway to chiropractic, something that they naturally see you as doing, not a paradigm shift. So the number is 69% versus 8%. So I'm in a 3% category, high trust, people who already have shown initiative. I'm going to go into their circle of influence, high trust category. I'm sticking with the gateways, back pain and neck pain. And then I'm going to do educational sales. Because remember, not everybody in their circle of influence is looking for a chiropractor, even though they have back pain. So now I'm going to have access to this high target market group. And then I'm going to go one greater. I'm not going to do a one-off. The referral program is one-to-one. Now I'm going to put them in a group. And a classic example is a dinner. If you did it like a referral dinner. So if you targeted your 3%, their circle of influence, now I'm in the introduction, the highest form of introduction category. I'm going to do the greatest form of business there is. Remember, when you're trying to get business, there's 3 core categories. There's needs, there's the need, the obstacles, and the trust. And remember, educational sales is the only factor that can address all 3 of those. Advertising cannot. Now, just by going in the introduction category, I already have the trust fulfilled. So my chances of my advertising working or my educational sales working is much, much greater because their defenses and resistances are much lower because I'm in a high trust category. So that is why I don't even have to be as good in these other categories of establishing need or eliminating obstacles if I'm already in a high trust category. So when I go into the introductions, I'm in a high trust category, high circle of influence, and then I want to use a combination of advertising, but more importantly, educational sales. Why? Because now I have the trust. Now I can establish need. That's educational sales. Establishing need. And then advertising is eliminating the obstacles, primarily time and money, specifically money. And what group am I doing that to? I'm doing it to a high trust, high influence category group, and I'm doing it with high leverage of time. It might be me talking to 5 people or 10 people or whatever. Now, you're almost guaranteed to get almost everybody who attends that meeting as a patient. That's the difference it makes. So that is the absolute highest form, quickest, highest form, fastest form. Now, when we opened offices, to give you an example, we went to educational sales. Now, when we opened offices, we didn't have introductions. We didn't have patients. So we had to use leads. So we scanned to get people's names that at least had lived in the geographic area, fit the demographic, psychographic, geographic profile, did not violate the psychographic barriers. They had a gateway to some degree, and they had the potential to pay whether they had a job or not. If they fit that criteria, so we already filtered them, if they fit that criteria, they were invited to the dinner. So now we had a higher probability. Now remember, we still don't have trust here, but we have a higher probability because we did filter them instead of just taking random people. So we have we targeted to hire people, and we would get 20 people. We'd invite 20. Typically 50% of those show up. You will not get 100% of them to show up. We invite 20, 50% of them show up. So we'd have anywhere from 8 to 12 people show up. We would do an educational sales presentation combined with advertising. In other words, we would establish need with the group. We would eliminate the obstacles of time or money and create some trust factors with trust. And that's what got that business. And typically out of 10 people, we'd get 7 new patients. That's exactly how it worked. And it was like clockwork. And that's how we started every practice, from scratch, from nothing. So those are the systems that are most effective to get new business. It's educational sales to your 3%ers. If you're not going to do it to your 3%ers, do it to your 20%ers. So, you know, there's always a hierarchy of better to worse. It's not a black or white scale. So could I still do them to the 80%ers? Sure. It's not going to be as good as the 3%ers. Could I still do them to cold calls? Sure. It's not going to be as good as my patient base. There's a hierarchy. So it depends where you're at is where you should be moving up the chart. Well, if you don't have any patients, you got to start at the cold calls and go to leads. But if you already have a patient base, then that's what you should go to, is your 20%ers and especially your 3%ers in their circle of influence. You will get those, whoever shows up will become a new patient. You almost have to be kind of bad to not get those people who don't show up. You almost got to be bad. That's how rich of a target market this is. So that is how we started practice after practice. We typically would do 2 lectures a week. And typically in 4 to 6 weeks, we're seeing 150 patient visits a week with my retention system. And that was that. Off to the races. That's exactly what happened, time and time again. But what did they know? They knew educational sales. They knew advertising. They knew retention. And they knew it at a skill set level of 5 or greater. That's what happened. And that's called training. So that's the optimal side, the best type of marketing, the 3% circle of influence, educational sales. and it's a high leverage point. That's the best. If you're going to go over the advertising, I would still do the same thing. I'm still going to go to the introductions with advertising. I'm not going to go to cold calls and leads first. I'm still going to do the advertising to my introduction active passive referral group. At least I'm already in a trust category. So that's where I'm always going to start with everything. Now, once I start going out of introductions, active referrals, and passive referrals, once I start getting into leads and cold calls, things get much more difficult. You're going to spend a lot more money with a lot less return, and you better have much better skill set with educational sales. You better know it, and you better have better skill set, because those people are not easy to get, and that's the difference.